Welcome to Adapting Class. NCLEX is a board exams. You don't know what they will throw at you. But sometimes you get unlucky and you get these kind of questions based on a recommendation. These 20 questions, if you're going to take your exams, I would like you to watch it. Watch it multiple times to be able to understand this concept. I created this question based on recommendation and I've created in such a way that to teach you. So 20 question, buckle up and listen. I want you to stop the video, answer it, then you play the video to see how I approach it. If you are not answering them the way I'm doing it, or you're making a lot of mistake, I want you to really sit down and master the content before you go and take your class. So let's get to them. This is the first question. I don't know if you've seen it before, but this is content. It's PKU, phenylketonuria. You have to know what it is. How do you answer questions? As usual, reading from the back. Which food should be included in the child's diet? Select order that apply. That means it's a teaching question. A 4-year-old child has a PKU, phenylketonuria. The nurse is providing dietary education to the parents. Which food should be included? If they ask you this question, PKU in the NCLEX, always they're going to ask you about diet. So please, I want you to know it. That is the only thing they may ask you. PKU, what diet you tell the parent, because that is the most important. If the parent does not know the diet, the kid is going to get sick. What is the problem? The kid cannot metabolize phenylalanine. And so if there is a diet that contains a lot of phenylalanine, is a problem for the kid. The best way to answer them is protein. Okay, it's a protein in a diet. So if you can eliminate a lot of protein in the diet, yeah, but specific protein is phenylalanine. Remember, you cannot eliminate all protein in your diet because you need some protein. There is a specific protein. But test taking strategy, if you see the answer choice, you think it contains too much protein, most likely it's not good for the kid. Therefore, vegetables, it will be good. Low protein pasta. You see the trick I told you. I don't know what it is, but I see low protein and it's a pasta and bread. This is what we give to the kid. Milk and dairy product has too much protein in it. You see another keyword, specialized phenylalanine free formula. That is your clue that, oh, this may be good. Lean meat, it does not matter. It's a protein. It has too much protein in it. Legumes and nuts has too much protein. It does not mean the kid should avoid protein completely, but to decrease the amount of protein. Milk products, lean meat, and legume contain too much protein. That will not be good for the kid. Therefore, fruits and vegetables, low protein pasta, and special formula is what these kids are usually on. So, this explanation, like I said, this is for the on demand, but I've explained the content over there for you, and that is the key. But you should make sure you understand this concept before you go and take your class. Which of the following toys should the nurse recommend as most appropriate for these developmental stages? I have made a lot of video for you guys on my channel, and those who are members, a bunch of videos on toys and plays. I want you to watch it. If you cannot answer this question, watch it again. And this is play because what health promotion is big. You cannot pass the N class without health promotion. It's one of the things because it contains maternity, peds, and what neonate and a screening test and all those things. So the nurse is providing guidance to a parent about appropriate toy selection for a preschool age. Preschool age, ask yourself, what stage are they in Piaget, right? It will tell you in the preconceptional age, right? The conventional age, they've not reached the age where they can understand concrete thinking. All they care about is what? Magical. And they want to develop their fine and motor skills. Therefore, a small marble Set of marbles will cause too much choking, right? Parcel may be too expensive, too advanced for them. So this side is portion of the answer choice is wrong. Riding cycle and dress up costume. Costume is basically imaginative thinking. So that sounds much better. Riding cycle, tricycle may improve their gross and motor skills, right? Tablet with educational apps and video game may be good, but it does not create creativity, right? Magical thinking, it does not have it. The chemistry set with the small measuring tools is too advanced for them. So the best thing is that. So know what they want. They want imaginative thinking, and they want to take some initiative and do things. So these are the things you want to do and think about it. So it's very, very straightforward. They are not difficult. A client was recently diagnosed with Guillain-Barré syndrome. Which of the following diagnostic tests will most likely confirm its diagnosis? Keyword GBS. How do you diagnose it? That's all. This is a content. But if you don't know, you know this is what? Autoimmune related, because maybe you eat something, you get upper respiratory infection and GI, and then you get disease, right? It's a form of demyelinating disease, but it's not diagnosed with MRI. So it's a trick. It's not like multiple sclerosis, right? So this is because of the acute nature of it, MRI will not give you information. The best way is cerebrospinal fluid. And when you do spinal tap, you're looking for protein will be increased, and then a lot of white count, the VBC, will be increased in those CSF fluid. And then you can do nerve conduction to see how they've lost motor function. Complete blood count and blood culture is not going to tell you, but most of the thing is because it's a viral infection, right? ECG, echo is for cardiac problem, right? So that's not. They may have autonomic dysfunction, but EKG and echocardiogram will not diagnose the problem. It will just tell you they have a cardiac dysfunction, but it does not diagnose. So the best diagnostic feature is cerebrospinal fluid. Which of the following condition is plasmapheresis an appropriate treatment? Select or apply. A nurse is reviewing a physician order for plasmapheresis. Concept plasmapheresis. How can you break it down? It's plasma. That means it's something in your blood. Pheresis. So basically, this what is what is plasma? Plasma usually is the area we have a lot of antibodies in it. So the best way to understand plasmapheresis is part of your blood where we remove the plasma, take it out, and remove all antibodies and give you back your blood. Which condition would you think of that you think you have to deal with antibodies? Autoimmune diseases. Autoimmune diseases are the most common condition that if it's too severe, we do plasmapheresis. In your NCLEX, there may be some like number one, Guillain-Barré syndrome. The treatment, if it's so severe, we use plasmapheresis. So that is one you have to know it. So that is one of the things I want you to know. Two, myasthenia gravis is autoimmune disease. We can also do that to remove the antibodies from the system. Sickle cell is not autoimmune. Rheumatoid arthritis, although it's autoimmune, there is no need for plasmapheresis. It's usually treated with medication. Thrombotic thrombocytopenia purpura is autoimmune disease, so we can use plasmapheresis for that. So these are some of the things that you have to use strategy to answer it. So the A, B, and E are all autoimmune. You can take the individual blood and wash it out and remove the antibodies. Okay, so those are the conditions that you can use for even kids with botulism. They can remove they can get botulism. You can use plasmapheresis for the toxin in the blood. You can use it for that. Which key points should the nurse include in the teaching? Select or apply, right? A nurse is educating the parent of a child diagnosed with what? ADHD, who has been prescribed methylphenidate. What key point? This is a classic NCLEX question. They like ADHD, they like methylphenidate because it's very common. But what do you think? Methylphenidate is a substance abuse medication and it's a stimulant, right? A stimulant, we're using it in these kids to make them more proactive. They can pay attention in class. So it's counterintuitive. It does not make them hyper, right? But what is the thing? It causes insomnia. So you give it in the morning. That's good. It will decrease the kids' appetite. Therefore, we got to watch their weight and the appetite. The medication is a stimulant. It does not cause drowsiness. You see how I can trap you? Drowsiness, right? It does not cause drowsiness. It makes you more alert. Report any signs and symptoms of increased heart rate and blood pressure. It's a stimulant, so you're going to increase your heart rate. You should stop the medication if you develop side effects. It will give you a rebound problem. You should not stop it. You should talk to the doctor. The physician may recommend periodic drug holidays. Because of the growth retardation in this case, sometimes we stop the medication and prevent side effect and let them spend some time for like 3 months, 6 months, and restart it again. That is drug holiday. So this is acceptable. A nurse is monitoring a pregnant client receiving what? Magnesium sulfate for severe preeclampsia. Which signs and symptoms may indicate magnesium toxicity? Think about it. Preeclampsia, I'm giving you magnesium. Why would I give you magnesium? So that you don't get seizures. What does seizure do? It increase your brain activity. If I give you magnesium, I'm depressing your brain activity so that you don't develop what? Seizures. So magnesium is supposed to depress the central nervous system. So when I give you magnesium, there are certain signs and symptoms as you see, which is common. Your reflexes go down, your respiratory rate go down, your blood pressure may go down, your urine output go down, your saturation go down, you have warm floor skin, your heart rate go down. But then when I see absent deep tendon reflex, that's toxicity. I got to intervene. When your respiratory rate goes down to up to 12, I got to intervene. When your blood pressure goes down too much, hypotension, I got to intervene. When your urine output goes down less than 25, that is bad. When your saturation goes down less than 95, that's a toxicity. It's not a common side effect. When your skin is warm and flushed, common side effect. When you become bradycardia, that is toxicity. So watch for toxicity. These are signs of toxicity. Even though you expect them to go down. When they get down to a certain level, you're becoming more toxic. Which of the following signs and symptoms are consistent with the condition selected apply? Cushing syndrome. What do you think? Too much steroid. When you're too much steroid, fat will deposit in your face, moon face, in your belly, trunk obesity. Your blood pressure goes up because of what? Water retention and sodium. Therefore, hyperpigmentation is mostly common for Addison disease. So your skin does not change, but your skin become thin and skinny, able to break down easily, fragile, but there is no pigmentation. In female, they develop hirsutism, hairy skin, right? Your glucose go up because it's a stress hormone. It does not go down. You have buffalo hump, fat deposit over your neck, behind it. You gain weight. You can have weight loss. There's other symptoms like cataract, right? Osteoporosis, that are all side effects of excessive steroid. But this is enough I've given you, but there's more associated with that. Which of the following findings are concerning in a dialysis process? Selected apply. A nurse is caring for a client receiving peritoneal dialysis. When you're receiving peritoneal dialysis, this means the dialysate go into your abdomen as a permeable membrane, and then will dialyze you, then it come out as an effluent. Because it's going to your abdomen, there's certain things we look for to look for signs and symptoms of complication. If it's cloudy and turbid, it's infection. If it's clear and pale, it's normal. If it's slightly pink after initial exchange, after first exchange, the catheter may bleed a little bit, so that is normal. So that's not bad problem. If it's you have a foul smelling, that's not good. It's infection. If it look dark, it means there is perforation, bowel. If you have abdominal tenderness, it's infection. If you have fever, it's infection. If you have increased urine output, that's normal. If you have red bloody dialysis, that is bad. If they said it's a female and they have pink output, check if they have in their menses, which is normal. So these are all bad stuff. Okay. And then she's teaching a client about food high in fiber for the healthy diet. Which of the following foods should the nurse include? You have to know this. High fiber diet, there's a class of medications that food that you should know. Grains, a lot of fiber. Fruit, a lot of fiber. Vegetables, a lot of fiber. Legume, a lot of fiber. Nut and seed, a lot of fiber. So I put him in the class so that you know I can list every fiber under the word, but I give you the group of the name, right? Whole grain. So when they give you wheat bread, you know that this is a lot of fiber. So you pick it. Okay. So this is the answers over there. I just, as I told you, a group of answers. Which of the following foods should the nurse recommend as a good source of iron? Select or apply, right? This is iron. This is also you have to know. It's health promotion question. All sorts of iron. The most common source of iron is spinach, red meat has a lot of iron in it. So those are very, very good. All grain does not, like we talk about, is fiber. Chicken breast does not have it. It's just a little bit of iron and lentils. I say ions and fiber in it. Orange juice is vitamin C. So these are good information to know about source of iron. The nurse is conducting a breast cancer assessment for a client. Which of the following findings should the nurse be alert for when assessment for potential breast cancer? All it means is which of the following signs should worry you about breast cancer? It's like similar to Cushing that I'm worried about. Breast cancer does not hurt. Most cancers are not painful, so a painless lump is worrisome. When the skin changes, it becomes dimple and red, good, it's bad. When you have nipple discharge, it can be bloody or clear, it's also bad. When the breast is swollen and changing shape, it's all part of the caution. Increased breast tenderness, like I told you, breast cancer does not hurt, it's not painful. This is not bad. Visible a vein on the breast is normal, but if it happens acutely, you should worry about it. And if there is dimpling, thickening, and pitting of the skin resembling an orange, we call it powder orange. Powder orange, this is also bad. So painless, hard not, skin changes, nipple discharge, changing shape, and dimpling, powder orange. These are all signs and symptoms of breast cancer. A nurse is reviewing examples of negligence in nursing practice. What is the key? Which of the following actions should be considered negligent? To be negligent, that means you did something, it get to the patient, and it caused harm. Always there has to be cause and effect. So administering wrong medication, causing harm to the patient, yes. Failing to turn and reposition the client, they were going to develop pressure ulcer. Yes, they develop pressure ulcer. That's negligence. Ignoring a patient call light for an extended period of time and the patient fell, that is negligent. Documenting a complete and accurate assessment of a patient is not negligent. Leaving bed rail down for a confused patient who fell later is a negligent. Failing to monitor a post-operative client vital leading to deterioration is a negligence. So these are examples of you have to do something and it has to get to the patient and it has to cause problem to the patient. So those are our negligent action. And next is observing a 3-year-old child in a pediatric clinic. Which of the following behavior demonstrate autonomy, right? Autonomy, that means you doing things on your own, right? Choosing which outfit to wear for the day is an autonomic action. This kid is trying to demonstrate that. Insisting on tying your own shoes, even if they struggle, is an autonomy. That's the age group they want to show autonomic here, preschooler, right? Throwing a tantrum when parents try to help them. Don't help me. I want to do my own thing. That's the autonomy. Asking for permission before using the restroom is not autonomy. Seeking help. Attempting to pour their own juice into a cup, that's an autonomic action. They're trying to do things on their own. Preferring to play alone instead of with other children, that's the non-autonomy. These kids at this age, 3-year-old, does parallel play. And parallel play, they play alone along other kids. So this is not autonomy. Which of the following responsibility are typical included in the nurse scope of action? What do you include in the nurse scope of action? What do you do as a nurse? What are your scope of action? This is a straightforward question just to tell you some of the things you already know. Performing assessment, right? And documenting it. Giving a patient medication, right? You cannot diagnose condition and prescribe treatment, right? You can diagnose in the nursing diagnosis, but you can prescribe treatment. Collaborating with the air care provider to develop patient care plan is what you do. Provide patient education on disease management and medication adherence, right? You don't perform invasive surgery. So these are within the scope of practice of the nurses. The nurse is monitoring a patient taking lithium for bipolar. Which of the following finding may indicate lithium toxicity and should be reported to the healthcare provider? Select or apply. Buzzword, select or apply. Pick those that you're confident. Start from the back. Lithium toxicity. If you take lithium, there's number one. Number one is GI symptoms, right? But there's other symptoms. There's a neurological symptoms. There's a kidney problem and everything. This question is asking you lithium toxicity, select or apply. So all these are GI symptoms. So that's number one. Fine tremor is a common side effect. It's not toxicity. When you take lithium, you're going to have fine tremor. If you develop coarse tremor, that is toxicity. Blurred vision is a toxicity. Confusion is toxicity. Polyuria, polydipsia is toxicity, and muscle weakness, ataxia is toxicity. All these toxicity, the most important one is GI symptoms. If they ask you which one should you intervene first, will be GI symptoms. They're going to have GI symptoms before all this thing will happen, and that is number one. Which symptoms should the patient immediately report to the healthcare provider? Select and apply. A client is prescribed statin, right? Ezetimibe and statin. These are two medications that you can use to control your cholesterol. Statin is used for it goes to the liver and it decrease liver production of cholesterol and LDL. Ezetimibe is usually taken orally and it stay in your GI tract and prevent you from absorbing cholesterol. So you can combine both. Remember, anything you take by mouth that work in your stomach usually will give you GI side effect, right? So those are common. So stomach pain and nausea will be common to that. Statin causes muscle pain problem. Fatigue and dark urine, these are all liver toxicity for both of them. Both of them are cleared by the liver, right? Um, in the process, you have to know that increased appetite does not indicate any liver injury. At the same time, it's not part of the statin or the ezetimibe medication, so it does not cause that. Yellowing of the skin, yeah, that's liver toxicity. And then your unusual bruising is also very good. Is a common side effect associated with this problem. So the only thing is increased appetite. Otherwise, all of them are expected finding. Not expected finding side effect associated with that. Which of the following safety and infectious control measures should the nurse implement? Select or apply. A nurse is caring for a client diagnosed with bacterial meningitis. Ask yourself, what is bacterial meningitis? It's a droplet precaution. If it's a droplet, you get this. You place you in a private room. The nurse wear surgical masks, not N95 when during care. Encourage visitors to wear surgical masks. Nurse is supposed to perform hand hygiene frequently so that it doesn't get infected. You should continue droplet precaution 24 hours after antibiotic until it's completely have full dose, at least 48 hours to 24 hours to 48 hours before you can take them off the precaution. Surgical mask on the client when he's outside his private room. So these are things you do for droplet precaution. Which of the following medication should the nurse question? Select apply. A nurse is reviewing client medication list and notice the patient is currently on fluoxetine. What is fluoxetine? SSRI. What is SSRI? Serotonin receptor reuptake inhibitor. Therefore, you should avoid anything that contains serotonin. St. John's wort is bad. Ibuprofen, not. Imipramine, I should have taken this off, but I left it there to let you as a teaching video. Imipramine is a TCA, tricyclic antidepressant. They also block serotonin, increase serotonin. You should avoid it. Selegiline is a MAOI, also increases serotonin. Diphenhydramine does not do that. Lithium does not do that. Sumatriptan does serotonin receptor. Linezolid, serotonin receptor. Tramadol, serotonin receptor. Volaphasan, serotonin receptor. Therefore, what is this video about? Every agent that has serotonin that I've listed, you should avoid it in the patient taking SSRI. Otherwise, they get what? Serotonin syndrome, St. John's wort, TCA, MOI, sumatriptan, linezolid, tramadol, and falacifan. These are content-based questions, like I told you. This list, you should know it. Which of the following findings are commonly associated with NMS? NMS is assessing a client with neuroleptic malignant syndrome. Which one do you think is part of it? First, you got to know the content. NMS happen when you're taking antipsychotic. That's all. They give it to you. Number one thing, your temperature goes up. Second, you have excessive muscle contraction. You become tachycardia. You develop autonomic instability. But number one is hypertension. But you can also get hypotension. When you start having hypertension, that means you're about to die. But the first thing you see is hypertension. Diarrhea is not associated with it. Mostly serotonin syndrome would give you diarrhea. GI symptoms is not NMS. They can have altered mental status because they confuse and it's not associated with tricyclic antidepressant. It's antipsychotic. And the last one, which of the following are commonly associated with cirrhosis? Liver injury. I just made a video about cirrhosis. So when you injure the liver, you get jaundice, yellow of your skin. You have the liver become injured, it cannot make protein, you develop ascites. The bilirubin go into your urine become dark. You don't usually go into diarrhea, you get constipated. Your platelet level go down, you have easy bruising. You get fatigue and you have anorexia. They have anorexia, they have constipation. Otherwise, the rest of them are correct. Thank you for watching, and I hope you gain something from this. I want you to watch it multiple times, write down the content area. If you have a question, email at Dr. But take care of yourself and bye.